The consistency from year to year is remarkable. Wright Medical has done extremely well again. What are some of the fundamentals behind your IR program? What do you think that investors and analysts are voting for when they vote for you in such force?
That's a great question. I think really consistency, credibility, and clarity also of messages. So the 3 C's: consistency, credibility, and clarity. And I think being able to do that day in and day out for a company that I feel very passionate about, and being able to tell that story with energy and drive is really, I think, one of the hallmarks of our program.
Now, last time we talked, Wright had been in the spotlight for having sold off a chunk of the business, and this year it's kind of the opposite in a way. Tell us a little bit about the highlights and the challenges that you've been involved in.
We have not stopped. Our CEO, Bob Palmisano, we have now announced recently a merger with another medical device company that will, together, we will be the premier extremities biologics company in the small cap space, hopefully aiming towards mid cap. So we may not hopefully be a small cap company for long, but really then putting 2 merger of equal companies together to create something with scale and size that can be very compelling from a value proposition standpoint for investors.
Now, it's interesting when you go through a merger like that, and you were telling me about how, having cultivated and carefully nurtured this investor base over years,
yes,
suddenly you're turning into a different company.
Yes, we have a different story. Being a larger company with the scale and size, we naturally would be more attractive to a different set of investors. And so I've had to kind of relook at our program and make sure that we are targeting the right people, not only for today before the merger closes, but really looking out who those investors are that we want as part of the new Wright Medical as we get bigger and close the merger.